medical knowledge and understanding in the mid-19th century. So medicine did not make much progress by 1848, and this was because there were three main ideas that limited progress. There was the four humors. Many people believed that illnesses and diseases were caused by imbalances of four humors in the body: blood, black bile, yellow bile, and phlegm. There was also the miasma theory, where many people also believed that diseases spread through foul-smelling fumes and unpleasant smells. This was apparent because during the warm weather, the smells would get stronger and disease would be spread out more quickly. Lastly, there was spontaneous generation. Furthermore, people thought that disease would suddenly appear out of nowhere because rotting dead material such as meat would often contain maggots or flies and disease when left alone after a while. There were also other factors that affected progress in medicine. Doctors had a lack of knowledge and understanding. Most people believed that they would live in the afterlife and wanted to be buried, so dissections were limited to only executed criminals. Any research was difficult to carry out because selections were limited. Lack of technology. Obviously, if people did not have the technology, then people could not gain any knowledge or understanding, such as microscopes for germs. There was also lack of funding. The government in this time did not believe they were responsible for public health. So, hospitals had to depend on charities for funding, which meant that little research could be done. There was also ignorance. Doctors did not want to change their attitudes and methods for healthcare, and many people also did not want to change their opinions of how disease was caused. Also, by the mid-1900s, surgery was still very much the same as prehistoric methods of surgery. This caused a lot of deaths, and surgery was very dangerous for numerous reasons. Blood loss. Blood loss was a problem because once people were cut open, surgeries became a race to beat time. Blood transfusions were not possible back then, and blood vessels could only be tied up with ligatures. Trauma, shock, and pain. Pain could not be completely relieved during surgeries at this time, so flailing patients would disrupt surgeons from their jobs. As a result, surgeries were often done quickly to minimize pain for the patients. And infection. Hygiene was a very big problem during this time, and doctors operated in normal working clothing, and tools were rusty and unclean. As a result, germs would enter the wound and cause blood poisoning, which led to almost half of all patients having leg amputation surgeries to die from blood poisoning. During the mid-19th century, women also hardly played any role in medicine whatsoever. This was mainly due to the education. Women were not seen as important to be educated because they were destined to be wives, housekeepers, and mothers. The 1852 Medical Registration Act was passed to ban women from entering the medicine colleges, and schools were a rarity for girls before the 1800s because science was seen as a subject for boys. Furthermore, women could not even go to universities. In the 1700s, they were not even trained to use the then new forceps, which even caused many men to be able to be midwives. However, women were widely accepted into nursing, and the church only allowed men as physicians and took licensing from women as healers. Public health at this time was ravaged by disease. Cholera, a very, very popular disease during that time, was widespread due to small privies and cesspools which contaminated water drinking supplies with bacteria. There was also smallpox. It was a contagious virus spread due to overcrowding in London because houses were often very close together and courtyards were packed with people. Tuberculosis was also a problem. It was a disease that affected people's lungs and was spread to an infected person's cough and sneeze.